Hello, welcome back. Today we are going to discuss management of snake bites, and our learning outline will include introduction, causes of snake bites, general clinical features, specific clinical features, investigations, and then final treatment. Snake bites can cause both local and systemic effects. Non-venomous snakes, following their bites, they cause local effects. These features of inflammation such as swelling, redness, and laceration. While venomous snakes cause both local and systemic effects due to envenomation. And in Uganda, 70% of snakes are non-venomous, and most bites in Uganda are always from non-venomous snakes. 50% of the venomous snakes are always dry, or like they don't have a venom in them, or they don't have envenomation. So as a result, envenomation does not occur. And in case venom is injected, the effects of venom on the body depend on the type of the venom that has been introduced by the snake, the quantity of venom, location of the bite, size of the bite, and general condition of the patient prior to the bite. In Uganda, the common causes of snake bites or venomous snakes that cause envenomation include the puff adder, Gabon viper, black mambas, brown forest cobra, Egyptian cobra, and the boomslang. Here are some of the illustrations of the common snakes in Uganda. We have the Egyptian cobra, the rock python, we have the olive house snake, we have the Babes Bay green snake, eastern forest cobra, Gabon adder, among others. As you can see, the commonest types. Clinically, a patient who has been bitten by a snake, as we have discussed, they present with both local effects and systemic features. Local features are mostly caused by the non-venomous snakes, the features of inflammation and ulcerations, while the systemic effects and local symptoms are caused by the poisonous or the venomous snakes. The local symptoms and signs include fang marks, malaise, swelling, local bleeding, pain, blistering, redness, and skin discoloration or necrosis. And the generalized systemic symptoms and signs include vomiting, difficulty in breathing, abdominal pain, weakness, loss of consciousness, confusion, and shock. Specific types of snakes have produced the specific types of venom that have different effects on the body. So we are going now to discuss the specific clinic features that are caused specifically by different types of venom following envenomation. In case there has been envenomation by the cytotoxic venom, this one which is produced by the puff adder and the Gabon viper, there is extensive local swelling, pain, and lymphadenopathy, which starts and occurs in 10 to 30 minutes after the bite. And the neurotoxic venom, that is the one which is produced by Jameson's mamba, Egyptian cobra, forest cobra, and black mambas, starting with 15 to 30 minutes after the bite, the patient develops weakness, paralysis, difficulty in breathing, drooping of eyelids, difficulty in swallowing, double vision, slurred speech, excessive sweating, and salivation. You observe that all these are features of neuropathies or neurotoxicity. In case there has been introduction of hemotoxic venom, which is produced by the boomslang, vine or twig snakes, there is excessive swelling and oozing from the site, there is skin discoloration, excessive bleeding, bloody blisters, hematuria, vomiting of blood, and even after some times, even the patient may also have shock due to excessive bleeding and coagulopathies. In case the patient has been introduced by combined venom, that is either both hematotoxic, neurotoxic, and cytotoxic, there is always a mixture of symptoms, and it is always of late appearance. Investigation is done in patients who have had snake bites may include a complete blood count, And you can also do whole blood clotting test at arrival every 4 to 6 hours after the first day. You put 2.5 ml of blood in a dry tube and observe after 30 minutes whether the blood is able to clot. And if there is incomplete or no clotting, that is an indicator of coagulopathy and could indicate that you're dealing with hemotoxic venom. Other useful tests include these ones are done based whether they are available and on the clinical need of the patient. Pulse oximetry to assess for the partial pressures of oxygen, saturation of oxygen in the body, blood pressure, respiratory rate, pulse rate, the complete blood count, as we had just said in the previous slide, to assess the levels of hemoglobin, packed cell volume, platelet count, prothrombin time, activated partial thromboplastin time, and D-dimer. A D-dimer is an indicator of inflammation, and it is the activated partial thromboplastin time and prothrombin time, the indicators for the degree of coagulation. Blood chemistry can also be done to assess the serum creatinine and urea potassium. In addition to that, you can also do urinalysis to assess for proteinuria, hemoglobinuria, and myoglobinuria in case of cytotoxic venom. And in other words, you can also do imaging such as chest X-ray, ECG, and ultrasound. The first aid management for snake bites is, first of all, you assure the patient and encourage them to stay calm, not to be anxious. You lay the patient on the sides to avoid movement of the affected areas. In short, you immobilize the patient, because the more the patient moves, the more the venom spreads into the body system. So you lay the patient on the side and you encourage immobilization, and you remove all tight items around the affected area. Leave the wound bite area alone and don't touch it. Don't introduce any medication. Don't suck using the mouth to suck at the venom. You just immobilize the patient and leave the wound bite alone as you transfer the patient to the nearest health facility. And here are a list of what not to do in case you have a patient who has had a snake bite. First of all, don't panic. Stay calm. Do not lay the patient on their back, as this may result in blocking of the airway. And do not apply tourniquet at the site, as this may cause ischemia and necrosis and death of the whole affected party. Do not squeeze or incise the wound to remove the wound, and do not attempt to suck the venom out. Do not try to attack the snake, as this will waste time, and do not use traditional methods or herbs to suck and remove the venom. Just transfer the patient to the nearest health facility. In case there is venom in the eyes, you should irrigate the eyes with a pint of water and cover the eyes with pads as you transfer the patient to the nearest facility. In the hospital, the skin is assessed for the fang penetration. The patient is immobilized with a splint, and analgesics such as paracetamol are given, and it should be noted that non-steroidal anti-inflammatory drugs should be avoided, such as aspirin, diclofenac, and ibuprofen, as these are associated with coagulopathies and other systemic complications. If no signs and symptoms develop in a period of 6 to 8 hours following admission, this mistake could mean that the patient was not envenomed, or the patient was bitten by a non-venomous snake. So you should observe for 12 to 4 hours as recommended. You give tetanus toxoid intramuscularly 0.5 mils. If the patient is not previously immunized for tetanus for the last 10 years, and then in case the patient develops local necrosis on the affected part, you remove the blisters, clean and dress the wound daily. Debride after lesion stabilize. If you first wait for the lesions of the bite stabilize, that is the minimum of 15 days, and then you keep debriding and cleaning. Antibiotics are only indicated in case the wound has been infected following the bite. In snake bites, antivenom should be given in case the patient develops signs and symptoms of envenomation. And here is the criteria followed for admission and administration of antivenom for all those patients who have had snake bites. Not all patients who have had snake bites should be given antivenom straight away. There is a criteria that is followed, which is going to be discussed. First of all, the patient should have signs and symptoms of systemic envenomation, that is paralysis, respiratory difficulty, and bleeding. And in case the patient is experiencing spread of local damage following the bite, that is swelling of the hand or foot, site that is within 1 hour of the bite, also swelling of the elbow or knee within 3 hours of the bite, swelling of the groin or chest at any time following the bite, and significant swelling of the neck and head following the bite, you immediately give the antivenom. This marks the end of our presentation. I hope this has helped us gain some insight on how to manage snake bites, first aid, and in hospital setting. Thank you for giving me your time, and I wish you good luck in your learning.